good afternoon, and welcome once again to our weekly COVID-19 public health update and media briefing with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today, it's once again Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer, as well as Sean O'Donnell, who is Program Administrator, Public Health Emergency Preparedness and Response for the Department of Health and Human Services. Reporters, members of the media, we do have a 1 o'clock hard stop, and also remember to use the chat to ask permission to record and also for Q&A. And now with that, Mr. County Executive, welcome, good afternoon. How are you doing?
I'm doing just lovely.
Wonderful.
Yes. How are you doing?
Very well, thank you.
So, I want to say hi to everybody and thanks for joining me for the weekly video message. This week, our nation reported a single-day record for COVID cases of 1.5 million cases. And experts say we're probably only diagnosing somewhere between 10 and 20% of actual infections, since a lot of people are not testing and are walking around with mild symptoms, unknowingly spreading the virus. And for everybody who will take a pause and say, well, but they're just mild symptoms, you have to remember that your mild symptom case could be somebody else's serious case. So the fact that your case may be mild and you don't feel symptomatic doesn't mean that giving it to somebody else will result in the same kind of case. And I think people need to be cognizant of that as they think about what their best behaviors ought to be. Our test positivity rate is at 25%, which is lower than the state average, but it's currently as high as it was during the first month of the pandemic in 2020. And our case rate of 283.4 per 100,000 residents is higher than the state case rate average due to our high testing volume, and is about 5 times higher than in any other time during the pandemic. And compared to the low point when we were down around 4 cases per 100,000 for a brief period this summer, this number is 70 times larger. So it gives you a perspective on where this has gone. Our top concerns and focus continues to be our hospitals and our schools. Statewide, there are nearly 3,500 Marylanders hospitalized with COVID, a number that's doubled over the past 2 weeks, and 1,500 more people than the previous height of the pandemic last winter. 84% of patients in the hospital with the virus have not received the full series of shots. In Montgomery County, we have 560 COVID patients hospitalized, which is the most we've had since the beginning of the pandemic. And our deaths so far this month are at 26, and we're not even halfway through January. I heard Councilmember Rice's disturbing story about during the council hearing yesterday about his mother having to go to Holy Cross Germantown Hospital with a heart attack after Shady Grove was too filled to accept her, and then had to be transferred to Adventist. This ordeal for Mrs. Rice and her family is a result, a lot of this is a result of unvaccinated people who are catching COVID, getting seriously ill, and taking bed space that is greatly needed by others. The statistics to continue to bear out that the unvaccinated are getting a disproportionately high number of cases and a disproportionately high number of hospital beds. And that's one of the effects of being unvaccinated. You get worse cases. We're thankful that Mrs. Rice survived this health scare, and we wish her well in her recovery. And I do hope Councilmember Rice's family experiences another wake-up call to the unvaccinated about the risk they're taking with other people's lives by refusing to get vaccinated themselves. Schools, dealing with this surge and the impact on our schools is really tough. We're in a different place. The good news is that we delivered 190,000 rapid tests to the schools. This should help families be more aware of the child's health status, as well as assist MCPS to know the status of their teachers and their staff. It is critically important that people who have COVID are identified and do not remain in the school setting, as this will only exacerbate the spread of COVID. I'm very concerned about where we are with schools. This is clearly a no-win situation. I've been looking at my email correspondence I've been receiving, and when it comes to the schools, whether they should be in person or virtual, and so far those emails come in about 50-50, depending on the day of the week. between parents wanting schools or needing schools to be open and are concerned about continued learning loss from virtual learning. And on the other side, I'm hearing from parents and students who think it is not the safest practice to have these many people in the school building with a virus that's spreading this rapidly and would prefer to be in virtual. Even though those, who tend to prefer it in virtual, I want to be clear that no one has asked us, at least nobody I've talked to has asked us to shut the schools down for the year and go virtual for the year. The hope is that people could be virtual for a short period of time until this wave goes through. The one consistent frustration I'm hearing from parents is that they need better communications from MCPS to not only understand what the decisions are, but why the decisions are being made. And Dr. McKnight has acknowledged this herself, and I'm appreciative that they're hosting a town hall meeting tonight, and I'm going to be joining them on that town hall. Staffing the schools has been very difficult, and this is impacting more than just teachers, but also school bus drivers, paraeducators, and the building service staff. These shortages provide real challenges for in-school instruction. This week, at the request of MCPS, we reached out to MEMA to request state support or resources, including the Maryland National Guard, who would be qualified to drive school buses for us. Unfortunately, no resources are available, but we continue to look for help and assistance from MCPS. But whether it's substitute teachers or school bus drivers, nurses, or schools social workers, these are professions that we can't simply find any person off the street to perform. And there aren't a lot of people out there who, even if they're qualified, who are looking to come back to work right now, apparently. I have, and I'm going to continue to support and assist MCPS and Dr. McKnight and the Board of Education with any help that we can provide them. County government staffing obviously has been affected too. Our record high rates of community transaction are not only impacting staffing levels in our schools, but continue to impact our government operations. 2 weeks ago, we announced staffing changes and service reductions in our fire department. And this week, our ABS stores have to have their hours reduced, and ride-on routes are being limited due to staffing shortages as well. We apologize for any inconvenience and encourage residents to continue to check out the county website and follow our social media pages for consistent updates. I do want to thank and acknowledge that despite our staffing shortages, our MC.DOT snow removal crews and contractors did a great job last week with significant snow and ice events that occurred. This was our most significant snowfall in quite a while. I kind of thought winter might be gone. And we heard very few complaints about the plowing. As regards rapid test distribution, as I mentioned last week, we're going to attack the surge by testing, vaccinating, and boosting, as well as mitigating community spread. We've ordered 2.1 million rapid take-home kits so far, test kits so far, and 588,000 have been delivered, received, and they're being distributed now. This week, we began to distribute free rapid tests at county libraries. On Monday, we distributed over 93,000 tests, and yesterday we distributed another 33,000. That is over 125,000 in just 2 days. And we've been running out of daily supply allocated at nearly every library location. We will begin distribution at times. That are shown on the website. Supplies go quickly. When we start distribution at 4, supplies usually do not last longer than 1 or 2 hours before the supply is gone. We're also working with the Poolsville community as well as the Tacoma Park Library to make sure those communities are going to be included in this distribution. It's a very big operation with a lot of logistics. I want to thank our entire team from library employees who are on the front lines helping us distribute, to our Medical Reserve Corps volunteers who are helping out at our distribution sites. Our emergency management and procurement teams have done a great job to move shipments that come in and get them out to residents as quickly as possible. And our communications operations and media are helping us to get the word out to the public. I'm grateful to the residents who understand how important these tests are and have come out, waited in cold weather, and been generally patient and understanding of this process. Excuse me. We're going to continue this process, and availability as more and more of the 2 million rapid tests arrive for distribution. We're also providing 190,000 tests now to MCPS, as well as tens of thousands to our African American health partners, and our Latino health initiative assure these tests are also reaching communities that have been disproportionately impacted by COVID. I do ask all the residents to avoid hoarding these tests for themselves. We'll continue to provide a supply, make sure it's available, but we need folks to understand that every resident and family deserves access to these tests. So with the supply we have, which is not small, we need to be sure that those tests are available to as many of our county residents as possible. And of course, in order to reduce this surge, we have to continue to test and isolate when tests come back positive. Today, we're launching a web portal that will allow residents to notify HHS if they do test positive. Residents who test themselves with a rapid home COVID-19 test can now report their results on a self-reporting portal that can be found on the COVID-19 testing section of our website. The more self-reporting we receive, the more accurate we can be with the amount of COVID that we're seeing in our community. So it's important to know those numbers as accurately as we possibly can. I want to talk a minute about COVID impact on pre-existing conditions. I think, as I told you before, since I received my positive test on January 1st, I've been isolating, and I'm glad to report that on the one hand, I'm feeling much better. However, I tested positive again today, my 12th day since my first positive test. And one thing that I noted while being sick was that my blood sugar spiked and has stayed high. And as a diabetic, this can be very dangerous. When I noticed my numbers, I immediately went to the internet and then spoke to my doctor and found lots of reports that this is one of the health impacts of the virus. It's one of the actual reasons that COVID can produce more problematic health outcomes for people. It's the higher levels of sugar that actually does some of the damage to our bodies. So if you're diabetic and you're monitoring your sugar, which we're all supposed to do, then if you see your sugar levels start to spike, please consult with your doctor. I consulted mine. She had suggestions for things that I needed to do. Making that call could be very helpful and help you keep your health situation under control. I realize that for as often as we've talked about comorbidities and how people with pre-existing conditions might be more susceptible to COVID, we generally don't go into the details, as well as the long-term impacts those who have caught COVID may be dealing with. So we just say, well, people with comorbidities are more likely to get it, but that doesn't really tell you why you're more likely to get it, and not so much get it, but why you're more likely to get sicker from it. So that's why I wanted to delve a little bit into the situation with diabetes, because it's a pretty frequent disease, particularly among older people, and people just shouldn't take the spikes for granted. They should try to get some additional support. If you do test positive for COVID, like me, and have pre-existing conditions, please take the extra steps and make sure you're closely monitoring any additional symptoms you might have as a result. I want to note a couple of other things in the world of non-COVID news. Today is the first day of the Maryland General Assembly's 2022 legislative session. This year, there will be a lot of continued focus on the state's COVID response, recovery, and specifically the impact of this pandemic on schools and children. Also on their plate is redistricting, legalizing marijuana, voting rights, and climate change. They're going to be important parts of this session's agenda. I encourage everyone to please refer to our legislative priorities for the 2022 session, as we will put in the chat, and we will continue to update you on progress with the bills that we're trying to support and to see that they get passed, and with support for projects that we hope get funded. And you can find this at www.montgomerycounty.md.gov/OIR/resources/files/2022.pdf. I'm sure they put this on the screen. I want to wish all of the county Senate and House delegate members a productive session. I look forward to working with them over the next 90 days. Next Monday, we're going to be honoring Dr. Martin Luther King Day, holiday, and National Day of Service. Every January for more than a decade, Montgomery County Volunteer Center has brought thousands of area residents together for an afternoon full of volunteer activities featured at its large-scale Dr. Martin Luther King Jr. MLK Day of Service event. However, due to COVID this year, like last year, the event has gone largely virtual and expanded to a week with a variety of home-based and safely distanced service opportunities available online at the montgomerycounty.gov/volunteer center. The Volunteer Center's 2022 MLK service event runs January 15th to 22nd and offers residents of all ages the opportunity to honor the life and teachings of Dr. Martin Luther King by participating in remote service projects that help others in our community. All event activities are free, but registration is required and space is limited for some projects. As we honor Dr. King by serving our community, we should also recommit ourselves to founding principles and the pillars of the civil rights movement, and that's the right to vote. Since last January 6th, there have been over 200 laws passed throughout this nation, fortunately not in Maryland, with the absolute intent to suppress and obstruct voting rights. I was pleased that President Biden endorsed changing Senate rules this week to pass the new federal voting rights legislation that will help protect our democracy. It is a sad note on how far this country has come from that original voting rights legislation had enormous support on both sides of the aisles and was routinely supported year after year by members of the House and the Senate, be they Republicans or Democrats. And the thought that voting rights has now become a partisan line division is a really sad commentary on the state of affairs. Everybody deserves the right to vote, and no one has the right, speaking of rights, to limit a person's right to vote. So I really appreciate what President Biden said during his speech, and I like the way he framed it. Do you want to be on the side of Dr. King or George Wallace? Do you want to be on the side of John Lewis or Bull Connor? Do you want to be on the side of Abraham Lincoln or Jefferson Davis? These are important questions every American should be asking when we think about and honor Dr. Martin Luther King this weekend. It does matter which side you're on. Thank you for your time. And now I'm going to turn this over to Dr. Bridgers, Dr. Stoddard, and Sean O'Donnell.
All right. Dr. Stoddard, okay, go ahead.
I'll let Sean go first. Obviously, I want to make sure Sean try and expeditiously get through. We're already 30 minutes in. We have a hard stop in 30 minutes. So go ahead, Sean.
Right. Thank you, Earl. Hopefully you should all be seeing the first slide from the pulse report. And the first thing I'd just like to share with you is the latest update from our CDC partners in tracking the variants across the region. They are now reporting over 97% of the new COVID cases within our region of the United States are the Omicron variant. This is, again, it was moving in this direction, and we do have confirmation that when they're genotyping the variants, that this is what they are seeing. So most of the cases that we're seeing come in, again, in our jurisdiction can assume to be the Omicron variant. The county executive touched on a number of these, so I'll move through very quickly. Just again, we've been tracking the positivity rates. It has been around 25% in our jurisdiction for the last few days after very quick increases. We are also aware that for the vast proliferation of rapid tests, unless our residents are submitting those in through our county portal, or the state has just unleashed a portal as well, unless they're being submitted through those, they're not going to be reflected in this. So we do ask that our residents, when they do rapid testing, regardless of if it's positive or negative, they do record that result, because it's helpful for us to understand where the disease is and what the amount we have across the county. Again, we've also seen that translation of the positivity rate play out to be just over close to 2,000 cases per 100,000. Again, it has briefly stopped its incline over the last few days. It's still too early to say if that is an ongoing trend or a blip, but we are, of course, tracking on this daily. As the county executive has mentioned, we have an increasing high rate of hospitalizations. Over 36% of our hospital beds have patients with COVID diagnoses in them. We remind folks that not every patient who's at the hospital has a primary diagnosis of COVID or with a COVID diagnosis. Is COVID the primary reason they're there, but they do take additional resources because of the isolation precautions for COVID patients. And certainly still a high number of them are there primarily for COVID. As the county executive mentioned, a large increase in the number of patients identified in hospitals. We expect to continue to see the hospital numbers go up for a little while, reflecting the higher case rates. Of note, the number of ICU patients has been steady for a few days, and we hope that remains around the same and then potentially declines.
You can design more engaging
But we are still
with no time at all,
monitoring that.
thanks to our AI-powered creative assistant. You're more than a small business, and MailChimp's got more easy-to-use creative tools to help you grow it.
Hold on just a second. Somebody's having a feedback. Can you, everybody mute, please? Thank you.
To mention, we are, again, because of the large number of the high prevalence of COVID amongst the population, including those being hospitalized, we are still tracking on our death rates. And one thing of note is that there has been a significant increase in the short period of time of deaths reported related to COVID in January. We've almost equaled our December number of deaths already to this date, but this is consistent with what we're seeing across the state. And our county does continue to be a much smaller proportion related to its population within the state. So again, we're hopeful that we're seeing a protective effect from vaccinations, as well as positive behavioral activities by our populations, including social distancing and mask wearing. We are at 49% of our population is fully vaccinated. Who are fully vaccinated have received a booster. We're continuing to recommend people come out and get boosters. We're continuing to see people do that, and we do emphasize that is your best protection against the Omicron variant, against severe illness in particular from the Omicron variant. We are now reporting that between 56 and 61% of our age 5 to 11 children have come out for a first dose of vaccine, and roughly 42 to 43% have become fully vaccinated. This is still a group where there's lots of individuals in our county that we are encouraging to come out and get vaccinated. And we have clinics. We have a number of clinics throughout the week after school at schools, and a number of clinics this weekend that are running all day to give not only children, but also their older siblings and their parents a chance to get a vaccine or a booster. These are just the statewide data. And then just to share with you what we're seeing at the county sites, we had significantly increased the county availability to do PCR testing. These are all PCR data in the upper table. We saw a slight decrease from the previous week, last week. A lot of that is attributed to the adverse weather that we experienced and people coming out at lower rates because of the snowfall. But I want to share the infographic that's in the upper left that shows the amount of testing at all county providers, and that is quite significant. The CDC is reporting that over the last 7 days, more than 80,000 tests were completed within Montgomery County. So it's a very significant amount of testing that's occurring, and we know that these numbers do not capture a lot of the rapid tests that are currently occurring, but we hope that it will start to get a larger proportion as people use our portal. And then just to expand upon the information about how we're distributing rapid tests, we are continuing to work with those populations which are highly impacted by COVID. We'll be doing, in many cases, second or third distributions throughout those. I know the initial distributions were we had a very limited amount of rapid tests, and with the influx of the iHealth tests that we've procured, we're going to start increasing some of these. This is all in addition to the library sites, which people have been coming out in very high numbers. Again, more than 126,000 have been distributed so far. That doesn't include today's sites, which are obviously very busy, and the sites we have planned through the rest of the week. So again, we have that online portal. I know that was shared earlier. We encourage our residents to use that. It is currently translated in both English and Spanish. There is a drop-down option on the top of the page to select the Spanish language version, and we are working on translations for additional languages right now. So at this time, I'd like to turn it over to Dr. Stoddard to hear his comments.
Yeah, the only comments I want to make are related to some of the inquiries that we've gotten around this request for bus support for MCPS. I want to clarify both all the timeline and the way this process works. So on Thursday, the 6th, MCPS reached out asking for support on this issue. We follow our standard protocol for requesting support. So which is the first thing we do is we ask local agencies through our emergency management group if they're able to provide support. We did that on Thursday. We got back no acknowledgments that there was additional capability to provide this support. So we followed the normal process and submitted a web EOC request with the Maryland Emergency Management Agency on the 6th. That request went up. They had some questions and back and forth on that, and we provided those by the 8th. Now, I wanted to clarify this process because the process that the state teaches, and we teach this locally too, is for requesting agencies to request a capability. What thing are you looking to be able to accomplish? Not to request a specific asset, not to request a particular asset from a particular agency. So we followed that process. We admitted they reviewed it and have told us as of the 10th that the state was not able to provide support directly. I reached out to Acting Secretary Strickland yesterday, as did Acting Director of Emergency Management Montgomery County, Mary Ann Souders. We both had conversations with Secretary Strickland and said, just so we're clear, what we've requested is not, is inclusive of the National Guard. He acknowledged that and said the National Guard is very busy supporting the testing operations that the governor has enacted across the state. Totally understand that. And so the next step in that process is for a Maryland Interstate Emergency Management Assistance Compact, MEMAC request to go out through the state from Montgomery County to the neighboring jurisdictions across the state to see if there are other neighboring jurisdictions that can support the request. The request overall is for 200 bus drivers, essentially, with the capabilities associated with that, CDL licensure, the ability to do passengers, things of that nature. There's some specific criteria they have to have on there to be able to qualify as a school bus driver. So that request is still pending with our neighboring jurisdictions. But I wanted to give some clarity because I know there's been some ambiguity about whether we directly ask for National Guard resources. We asked for a capability. We made sure that we are inclusive of National Guard resources. We wanted to make sure that we're, the process, we're following the state process for requesting emergency resources through the Maryland Emergency Management Agency that is doled out across state government to multiple agencies, including MDOT, that would include the National Guard and others. So I know that there's some, ambiguity about what exactly was requested, but I wanted to clearly spell out the process that we follow with the state. It's what we train on. It's what we do all the time. But, just obviously there's a specific process that we follow. And I wanted to make sure that we acknowledge that we are following that exact process. If, for example, the governor wants a specific letter to request the National Guard for this asset, we are happy to provide it, but that is not the way we've been trained to do it through the assistance process that exists at the state of Maryland. So it's also, again, the assistance, the process that we follow within the county as well. We follow the same process. So I just want to make sure that we're clear about what process is being followed. So I'll stop there and I think we can take questions.
Thank you, gentlemen. We have about 18 minutes before the county executive needs to go. So let's try to get to your questions as quickly as we can. Let's get started with you, Stephanie Ramirez, Fox 5. Good afternoon, Stephanie.
Hey, good morning, everybody. Thank you for clarifying that, Dr. Stoddard. So I do want to ask then, with this jurisdiction request then for the 200 drivers, is it solely on the state emergency management that's responsible for securing that? And then are they also required to have CDLs? And then also, Councilmember Rice had said earlier today that the county was looking at all measures, even reaching out to, military, veterans groups, or retired bus drivers. Does that also fall on the state emergency management in that request, or is that on the county level? What has to happen there? And I have a couple follow-ups if possible.
Sure. So the Maryland Emergency Management Agency is a facilitator for the MEMAC requests. We operate through their portal. It goes out to the emergency management directors across the state. Those emergency management directors share it internally with their respective partners across the county governments, and there's an identification process that goes through. It's basically I would compare it to like an RFP process where we put out a request for help. Agencies across the state see that request, they understand what the parameters around that request are, and they make affirmative acknowledgments that they are able to help support the full request or a part of the request. And so really the Maryland Emergency Management Agency is really a broker for a county to be asking for this resource across the state. That's typically the way this works.
So the process of then asking for veterans groups or retired bus drivers, that would be handled through the state then?
Well, I saw that from Councilmember Rice, and I'm not familiar with where that request came through. This may be something that the local MCPS may be doing directly themselves. I haven't been, I'm not sure, I'm not aware of, and I can certainly follow up and find out whether emergency management's been involved in that part of the request. But that was, when I heard that this morning, I was unfamiliar with that part of the request.
Okay, and then if I just at least can get one more follow-up. I know there's a bunch of reporters who have other questions as well. But I do want to ask more county executive about the vaccine passport. And I did ask this question to Councilmember Albornoz earlier. He also said this morning that he believes the vaccine passport bill as is would not pass. There's many questions that need to be answered, including if the vaccination status should include boosters, not just fully with 2 shots for the 2-shot vaccines. My question is, if one of the models that they're looking at being done in other cities is New York City, right? And in New York City, they can't really check for medical or religious exemptions. So if you are not vaccinated, you can just show a negative test. There's no incentive then to get vaccinated. And then on top of that, we know that you can be fully vaccinated and be boosted and still share this variant. So with all of that said, what is the actual goal here of this vaccine passport? And is it really just too late for that in this region?
But from my perspective, it's not too late for anything that would potentially reduce the spread of COVID. If you were to ask the hospitals how important reducing the spread of COVID is, particularly the speed of spread, they would tell you absolutely. Anything you can do to knock down the speed of the spread would be helpful. And we know that if you're unvaccinated, you're more likely to be getting COVID, you're more likely to be getting a worse case of it. It's something we can do that would make a difference. It's not the slam dunk at this point. There are things we should have done a long time ago. Why the numbers of the case, the amount of spread in the community right now, we wouldn't have even talked about being open a year ago. So we've accepted more than that I think is good, but that's the direction things have gone in. But this is a place we can actually, I think, make a tangible difference. And it's the one place where everybody's masks are off. That's why we're not extending it into retail and other places where people wear masks. That would be a bridge too far. But here you clearly have people in there with masks off. Anything we can do to knock this down, we should do.
I would also counter one point that you've made, Stephanie, that you can go outside in the rain with a raincoat and an umbrella and still get wet. That doesn't mean it's still not a good idea to wear a raincoat and an umbrella when you're outside in the rain, right? So just because something can happen, but it's far less likely to happen, doesn't mean it's not working to do what it's supposed to do. Being vaccinated, I think CDC posted this a couple months ago, makes you 5 times less likely to contract the COVID-19 variant, COVID-19 from others who are not vaccinated. And so obviously, if you're less likely to contract, those who have not contracted cannot spread, and therefore you're less likely to inherently spread in a population. Now, on a case-by-case basis, it gets a little bit wonky, but when we're talking about public health interventions, we're not talking about case-by-case, we're talking about population-based numbers. So on a population basis, people who are vaccinated are less likely to be able to sustain transmission than people who are not vaccinated. And so that's the key to all of this.
I'll throw it to my other colleagues, but if I can get a chance to ask a follow-up, I would like to. Thank you.
Thank you, Stephanie. Next up, Dominique Bonesi, WAMU. Good afternoon, Dominique.
Hi, thank you, Lorna. Dr. Starter, thank you for bringing up the buses. And I just wanted to ask, because I know that other counties in the state have had issues with bus driver shortages. I'm just wondering, what are you predicting your likelihood of getting these bus drivers? 200, that's a lot of bus drivers to fill sort of the shortage, and with other schools in session in other counties, you know, what are you thinking as far as this being a possibility?
I mean, we didn't feel like it was likely that the state would be able to support this, and I don't feel like I think it's less likely that other counties will be able to fulfill this. But obviously, we have to ask, we have to try, and if maybe there's some pool of drivers that we're just not aware of, we want to make sure that we're putting out the request to be able to try and fill it. But I candidly am not optimistic, because as you noted, everyone is seeing these shortages. There is not some pool of there's not a secret bus driver organization that's been waiting in the wings to fulfill these requests. It's, you know, if there's a resource that was out there, it's been tapped long ago to try and go in and address the issues that we've been feeling. And obviously with this variant, it's just, you know, we're running on empty, and now there's a variant that's far more transmissible. So you can't go back to the well for additional resources in most cases. So we have to try, because that's, you know, we have a responsibility to try and make sure. And if we don't want to miss something because we assume that there aren't resources, but I'm candidly not incredibly optimistic that the state partners will be able to meet it, because as you said, they're all facing the same issues that we are.
Any alternatives you can think of other than wondering how many parents can drive their kids in a van of some sort, which is not exactly COVID friendly?
Yeah, we're looking at, I mean, they're certainly looking at contract options. Obviously those are difficult, because then you deal with, do they have license in the state or not? Are they background checked? All the issues that you face there too. But we're trying to look through every possible avenue to try and find this resource for MCPS. They're trying themselves to find additional resources, but obviously we're here to support them, just as the state is here to support us. And so I think everyone's working to try and do this. You know, having spoken to the state, they're looking at other options too, because they recognize that we have a real need. This isn't made up, and that they recognize that others are going to have a similar need. So I know that the state is still working on it. While they've denied the initial request, they're working on it too. So I've gotten that commitment from both the governor's office and the acting secretary Strickland.
Thank you.
Thank you, Dominique. Rebecca Tan, Washington Post. Good afternoon, Rebecca.
Good afternoon, and thanks for having me. My first question is for the county executive. Can you talk a little bit more about how you're feeling with your COVID situation at the moment? And I know there's some degree of confusion right now, you know, even in a place like Montgomery County, about how long people should be quarantining. You know, what's your advice, given that you're sort of in a position that?
Well, I'm kind of where some people in the CDC are kind of trying to get is that you shouldn't be returning to anything until you get a negative test. It's clear, you know, that, you know, after 5 days, there's no guarantee that you're not still carrying and spreading. And, you know, my symptoms were weak enough by 5 days, I could have easily just thought, oh, I just got a cold. It's not COVID anymore. You know, my nose is sniffling. Well, I'm testing positive every day through day 12. And so, you know, this is, I was supposed to be over and done with and not spreading, and I shouldn't be having it, but I'm having it. And so just routinely saying you should just be able to come back without getting a test, I think is a mistake. I understand the tests are in short supply. The county, because of the work that's been done, has enough tests that I think it's reasonable to expect people to be able to get a test before they come back. It's certainly important in schools where you're going to be putting kids into a lunchroom with no masks on. So you know, to me, the stricter we are, the better off we are. I think letting up too much was a mistake, and you know, we're all going to wind up paying for it one way or the other. It would be good if we just followed the health advice, and that people were not, you know, in my mind, not changing the advice based on concerns about political circumstances.
Got
I
it.
would
And
not be doing that.
got it. My second question is for Dr. Stoddard. You went over the request for bus drivers. Has the county asked the state either this week or last week for help in any other areas? Can you say what they are?
I don't think we've filed any other requests. I certainly could follow. I don't want to tell you that we definitely haven't. I don't think we filed any other requests for specific support. I know we have been routinely requesting support for test kits, particularly in the school system, and the school and the Maryland Department of Health has been routinely providing them. But we haven't filed any through this MEMA process for additional support like that. But there have been some standard requests that go up all the time. So I don't want to create the misleading perception that state's not helping us on some things, because they clearly are. But I don't think there's anything else that's sort of a unique or one-off that we've requested besides the bus drivers.
Got it. Thanks.
Thank you so much, Rebecca. Next up, Amy Cho, News 4. Good afternoon, Amy. Amy, your audio sounds digitalized.
I
Want to try it again?
Than I do.
Let's see. If not, just type the question on the chat. Yeah, your audio, it's not working. Let's move forward with you, Kevin Lewis, ABC 7, and Amy, try to type on the chat. Thank you.
Hi there. So in two recent shootings in downtown Silver Spring, the December 29th shooting that led to the officer-involved shooting, and then the music video shooting from last Thursday evening. In both of those cases, police had to request patrol units from neighboring districts. In the first shooting, I believe 2 districts. In the January 6th, 3 districts. Officers tell me they are at bare minimums. And in the first shooting, they had to bring so many officers into Silver Spring that the whole Wheaton district was left with 3 officers and 1 supervisor. What's your response to that, Executive Elrich?
I think, we've known that we're short for a while. I'll go back to what I've said before. This is a reason why 2 years ago, we put in a budget with a pay plan for the officers that we had negotiated that would have helped with recruitment. And we didn't get that. We continue to lose officers. That's not news. It's kind of like yesterday's news. I think COVID has kind of amplified that a little bit, because people are getting, we have no departments where people aren't getting sick. So, and we've told the chief very clearly, I don't know if you're in the meeting, but it was the directions are to pull whatever resources you need to deal with it. So he has latitude to pull what he needs. Hopefully he's going to keep doing that. If they feel they need to draw from a neighboring area because they're concerned about the safety and they can't pull together people quickly enough from, you got to remember how big the Silver Spring district is. It might actually be faster to get somebody from Wheaton than it would be to get somebody from Burtonsville. So it may just be the simple logistics of who are the closest people to be able to respond to. I don't think they would delay a response to bring it from farther away just on the principle of it going from the same district.
Do you feel it's time to take some of the specialized units on a temporary basis and put those individuals to patrol? I'm sure that wouldn't be a popular opinion or decision, because you work hard to get into crew or major crimes, but are the numbers in patrols so low that it's possibly time to temporarily dismantle some of these specialized units?
I would leave that to the chief. I mean, the specialized units carry out some of the specialized investigations. For example, they wrapped up, I think 3 people who were involved in 20 burglaries. They were able to take those people off the street recently. I don't want to give up our ability to do that for this. So if, like I said, he has the ability to move people where he thinks they need them. And if he doesn't feel he can do that here, then I would support whatever else he thinks he needs to do. There's obviously a trade-off between some of these units.
Certainly. Have you had a chance to look at the officer-involved shooting video that the AG's office released this morning? I realized they released it within the last 3 hours.
Yeah, and I've been in meetings for the last 3 hours. I'm going to look at it as soon as I'm done with this meeting, my next meeting.
All right, fair enough. Thank you very much.
Thank you.
Kevin, one point I want to raise too is the police department, like our other public safety agencies, like many agencies across county government, was also hit by a lot of COVID issues during the same period as these two shootings. So I think up to 10% of our sworn officers at one point were either positive on quarantine or somehow out of the. So it was a really across the board. We talked about, we've seen improvements within fire rescue. We've seen improvements in that in police department too. So that is another factor. County executive's right. We're short year round at this point because of the inability to recruit. We were particularly short during those weeks when the COVID surge hit our personnel as hard as it's hit us anytime.
Thanks for that added context.
Thank you, Kevin. Here's the question from Amy, show NBC4, wondering if you could speak more on the possibility of MCPS going virtual. At the 10:30 briefing earlier today, we heard from council members Albornoz and Rice about how the staffing shortage is making the in-person school situation untenable. Who wants to answer that?
I'm kind of in the same place. I mean, I don't see, teachers can't be in two rooms at once. You can't put more than a classroom of kids in one room to make up for the lack of a teacher. We know anecdotally that, they're just having trouble. If you look at the number of vacancies versus the number of sub positions they're able to fill, there's just not a match. And emptying out central office isn't necessarily going to make that match either. And you just can't pull people off the street to be teachers. So I think that, regardless of, how you feel about the instruction itself, if you can't even deliver, uniformly consistent instruction in a classroom and you're worried about, losing more teachers, which I think is realistic. No one's told us we're at the end of this pandemic. Everybody's anticipating more to come. I've, have thought for a while that the pause idea made some sense with some modifications. And, I've had conversations with both folks on the labor side and folks in the administration about how to try to accommodate that. I think, the hardest thing to deal with is the equity issue, because if you do close things down and you don't have an accommodation for students, it's not like a year ago when you could set up hubs and closed daycare centers or closed rec centers, because all these things are open now. And we don't have flexible staff because they're all doing jobs now that everybody wasn't necessarily doing before. So there are more constraints on how to mitigate learning loss, I think, today than there were, a year ago. So I think they really need to think about this.
Mr. County Executive, it's 1 o'clock. We do know you do have to go. Not kicking you out, but you do have to go. The other officials are staying, correct? Okay. Thank you, Mr.
I will talk to you all later. Maybe next week I'll be negative.
Okay. Hope you feel better. Thank you for joining us today.
Bye.
Up next, let's see Bonnell, Bethesda Beat. Good afternoon, Steve.
Good afternoon. I think Craig Rice's story did a really good job of kind of humanizing what's going on in the hospitals right now. I'm wondering, I can look at like kind of, what alerts each hospitals are on and, what the situation is. But I guess in a very basic question, where are we at? I in past life, I worked in Frederick, and I think weeks ago, they're only one hospital county, but they announced they were in crisis mode and kind of dealing with services in a different way. Are we still not close to that given where we're at? I know Sean kind of hinted we might be at the top of this year, but it's not yet a trend. I just kind of wanted a general reaction in terms of where we're at with hospitals, I guess.
I'll start, and I'm sure Sean can add to this. The hospitals are in fairly bad shape, and there's no one number you can look at that sums up the story. I think so. We look at all the numbers, and we also talk to the hospitals. Sean and I were both on a call on Friday with the hospital partners to try and talk through what they were actually seeing on the ground in the EDs and throughout the facilities. And they're being crunched in multiple different directions. And that is, they're being crunched from their own staff being unavailable and just a large number of patients in the hospitals. Not all of those patients are the most severe patients that we saw earlier in the pandemic when we didn't have vaccinations or other tools or an understanding of really how to fight COVID from a healthcare perspective. So the outcomes are a bit better, but if you just surge a hospital to a certain point with more patients, and then you take away more staff, you get to points, and they're not necessarily constant points, where there are real pressures on getting people in and through an emergency department. We've had wait times for our EMS units being waiting at hospitals that ranged into the hours. And obviously that takes EMS capability out. So you can't point to a single number and say, this tells the story for hospitals, and this tells the story of the impact that the hospital shortages are going to have on people's health and healthcare. But I can tell you factually, there are delays in our healthcare provision in our hospital that certainly, I don't want to say on the edges, but like it's difficult to say this many people have died as a result of these things. There are people being impacted today in Montgomery County based on reduced healthcare capability, driven in large part by a large number of people in the hospitals and a large number of providers who are themselves sick or caring for someone who's sick. So, Sean, I don't know if you have more on that.
Yeah, it's very much a qualitative versus quantitative story. You know, in emergency planning for events that surge hospital capacities, it's one thing to talk about surging for 24, 48 hours, or even a few days. But doing this on an ongoing basis presents sort of unique challenges. You know, right now we have a number of hospitals who have increased the number of patients per clinician, you know, than over what they would routinely do. They're in that status where they're trying to care for more patients at the same time than what they normally would do, because there's not more staff that they can surge up. The impact of their staff testing positive, some of them symptomatic, some of them asymptomatic, that's having an impact on them. Additionally, you know, even if these patients are not there primarily for COVID, as I mentioned before, having to change your PPE between patients, that takes a lot of time. That reduces the amount of time you have to spend caring for patients. So it's a complicated qualitative issue that is exhausting the staff at the hospitals and reducing the amount of time they have to spend on patient care individually. And again, it's why we're trying to remove non-essential clients from showing up at hospitals, like people just showing up for testing. You know, those, and you know, I know some of the hospitals have begun to reduce procedures that are closer to the elective side than the necessary side, but even elective procedures at hospitals are still being done because they improve someone's quality of health. So, you know, pushing those back for a later date is going to impact the health of our residents.
I want to just versus earlier in the pandemic, more residents from outside the county. I'm not blaming, you know, the hospital's got to care for whoever needs help. Is that more so true in this current surge about the hospitals having residents from outside the county, or has that been pretty constant since March 2020?
I can tell you that we see probably about, our hospitals see about 25% patients that are from outside of the county as their residents. But I don't have the number strictly of how many of our residents go to hospitals outside of our county. That's just one of the things. If you live near the edge of a county or a jurisdiction, you may be making use of private resources that are in other jurisdictions. I don't know how that has changed, but it's, as you mentioned, it's a common thing, and it's not something that hospitals have any control over.
I would also say, Steve, I think there's a lot of arguments being made that I think are pretty irrelevant about hospitals. And what I mean by that is, like, I'm not sure it matters a whole lot of where the patients are coming from. I'm not sure it matters a whole lot whether they're sick with COVID or because of COVID, hospitalized because of COVID or with COVID. To be honest with you, at the end of the day, the question is the hospitals in the area surged or are they not surged? Because I'm not sure that even if the number were 60% were from outside the state or outside the county, I'm not sure how that would be relevant to someone like Councilmember Rice's mother, who comes to a hospital and they can't provide care for her and they have to move to another place. So obviously, we care about the surge in hospitals regardless of the source, whether it's driven entirely by staff outages or entirely by new patients. In this case, it's driven by both. But I think the important thing is, I think there's a lot of debates about what is causing this surge that I don't think at this point there is a surge. There's no denying that there's a surge. There's no argument over the fact that hospitals are feeling a crushing level of responsibility for care while having less resources to care for it. Those things are all true, and I'm not sure. I think some people are making arguments to further political or personal views than they are because it's actually relevant to the care of patients in our healthcare system.
Thank you, everyone. Very thorough as always.
Thank you, Steve. Up next, Randy Bass, WDVM. Good afternoon, Randy.
Good afternoon, everyone. Thanks for having me on this briefing. Always appreciate it. Question regarding rapid testing. Are the results that get reported to MCPS also passed along to DHHS and other appropriate parties? So my question is, are those counted in the countywide counts, or do families need to be double reporting through both the school system and through the new online portal?
Yeah, so I don't believe that the results that are being reported through the school system are becoming part of the state and local public health tracking. It is being used by our school system partners and in consultation with HHS to inform us of what they're seeing with regards to school systems, but it's not going into COVID link Immunet. And again, those, when it was set up, it wasn't designed to do that. Rapid tests were not as common as they are, a few weeks later. It was mostly designed to capture people who got a PCR test outside of the school system or a rapid test outside of the school system. Now that they're much more common, we've opened up a portal to capture that, as has the state. We're working with MCPS to consolidate our portals because it just makes sense. We're already aware that people could be confused about where to report. We certainly don't want to put people, make them have to do that twice. So we're hoping within the next week, we'll have something that can be a little bit more consolidated.
Appreciate you clarifying that, Mr. O'Donnell. And I guess going forward, can you underscore why, or another official on the call, can you underscore why it's important for people to be reporting these rapid test results? It sounds like with the school system not being included in some of the official counts, that the case counts and the positivity rates that we're seeing are underreported or might not be as accurate as they could be.
Well, let me stress, the most important thing is that the individual knows their status of whether they have a transmissible disease or not. By far the most important thing. And at this point, I hope that the vast majority of our population understands what to do if they have a positive result, what to do if they have a negative result. And we're certainly continuing to share that guidance with them. As far as reporting it in, it gives public health an idea of the disease load throughout our community, what protective measures to recommend. It gives our leadership, we can then recommend to our leadership where we need to recommend different activities amongst our population as far as what they do socially, what they do business-wise to try to control the spread. It also lets us know geographically where this is occurring and within populations, if it's disproportionately hitting populations. Again, so we can update our guidance to the community. We use it, as I've mentioned on some of these calls, to determine where we need to do vaccination clinics or testing clinics to support our population. So it is important that that our residents do give us an idea of positive and negative results that are done, whether it's rapid testing. All of the labs who do PCR testing are required by law in Maryland to report COVID results to the state, and then that gets filtered down to the locals for all of those same reasons. That if you do a rapid test at home, though, you don't have the same legal requirement that a lab does. So we encourage people to be part of that reporting system.
Thank you very much. Appreciate that.
Thank you, Randy. Up next, Corey Smith, NBC4. Good afternoon, Corey. Corey? I think it's gone. Stephanie Ramirez, Fox 5. Did you have a follow-up, Stephanie? Unmute.
Just a quick question. If someone could just kind of very quickly explain, before January, the conversations on rapid tests were that you could still get a false negative or a false positive. When did that turn into we absolutely need to take a rapid test to determine what's happening within the community?
Rapid tests, like any other test, have their own set of issues, but they're at this point, the rapid tests that we utilize in the market right now are like 95% effective, sensitive, and selective, up and down. And so having ability to have false negative or false positive 5% of the time is a lot different than they're not effective. So rapid tests are a lot better than a personal assessment of whether you're doing better with symptoms. The CDC's own data says that after 5 days, roughly 31% of people are still going to be infectious. A rapid test would help us narrow that number from 31% to a much lower number on the back end. And that's why we're encouraging, that's why actually CDC says it is the best approach, and I'm quoting them there, to include a rapid test on the back end. The FDA hasn't approved rapid tests for that narrow utilization. And so the CDC doesn't want to just say you should do a rapid test on the back end, but they agree that it is the best approach to do those things. And so obviously in Montgomery County, we've attempted to go with best approaches throughout the pandemic. And so this is a case where it is absolutely a better approach to tie a rapid test on the back end of a isolation period when you've tested positive earlier, you're trying to get out of it. Because again, 31% of the people who are at day 5 are still infectious. CDC's own data says that. So the changes they've made to isolation and quarantine, I get why they've done them. They're societal changes. They're not really public health recommendations. They're changes to keep society operating. I believe, and I think CDC believes too, in their best approach commentary, that a rapid test is another way to make a more secure decision that you're doing the right thing. And I want to be very clear about this too. Society functioning is a very different thing from whether you should feel comfortable going and visiting your immunocompromised loved one 5 days after a positive COVID test. You should be making some decisions that are a little bit more stringent when it comes to people who are immunocompromised or otherwise in a condition where they could have a severe outcome from COVID-19. And so that's why these are guidelines and guidance, because there's some individuality that has to be applied to these. This is not a one-size-fits-all recommendation. So I think that's the key thing here.
Thank you, Stephanie. I do not see any more requests of questions from the reporters. Members of the media going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. Have a great afternoon. Stay safe. We'll see you again next week. Bye-bye.